name is Deb Davies, and I want to share with you about acupressure for labor and birth. So my story began in 1996. I began in the acupuncture field. I worked for an acupuncturist in the suburbs of Philadelphia. And then I went into massage school in San Diego, California. I wound up having two babies. I had one in 2001, and my first baby, unfortunately, died of a cord accident, an umbilical cord accident. And so that was kind of the worst thing that happened to me in my life, but that helped with the best thing, which is now my career and my extreme passion for helping pregnant and laboring moms. I went to Pacific College of Oriental Medicine. I studied acupuncture and Oriental medicine, graduating in 2008. In 2007, I had done my first doula gig, where as a massage therapist, I attended a birth for one of my clients. And it wasn't until 2013 that I actually studied from a company called DONA, which is Doulas of North America. And I chose that company because I felt like it was very high standards. But then when I went to certify with them, it was disappointing because they had a clause that said, if you have a medical license and you're serving as a DONA doula, you will not use your medical license while serving as a doula. And for me as an acupuncturist, that was the number one thing that people were going to be hiring me for, was because I'm an acupuncturist. So it didn't make sense to me. So I became a CEU provider for California, the National Board of Acupuncture. I started teaching, became a childbirth educator, teaching hypnobirthing, and I'm currently in a doctorate program working on my doctorate of acupuncture and Oriental medicine at Yosan University in Los Angeles. So I'm just gonna tell you some of the topics we'll talk about today: the benefits of prenatal acupuncture, acupressure, how acupressure works, how we diagnose, what acupressure can treat, some of the benefits of postpartum acupressure, and then acupressure for birth itself. So in terms of benefits for prenatal acupuncture, so this is when the woman's pregnant. So I see women all through, they just peed on a stick and just turned up pregnant, and they're coming to me because they feel nauseous or they're vomiting, all the way through to the end of the pregnancy. So when people get acupuncture in the clinic, it really helps with increasing blood flow to the baby. And these are the same things that acupressure, where you're just using your hands, can also help with. The acupressure can help remarkably with decreasing stress and anxiety. What pregnant woman isn't a little anxious, especially as we're getting closer and closer to their birth? We can help turn on the correct hormones, helps relax the muscles and tendons in preparation for birth, and it also reduces the pain and discomfort, any aches and pains, back pain, whatever they might be having. So some of the benefits of getting acupressure postpartum is that it can increase your breast milk supply, which is really a big thing for a lot of moms. It can help with relieving mastitis, any clogs that they might get in their breasts. We can decrease postpartum depression, postpartum anxiety, definitely helps with improving mom's mood. It helps with relieving pain, reducing stress, and even for C-section recovery. I've done a lot of support with that, and unfortunately, we have more and more C-sections happening, so we want to be able to help those moms with their recovery. So how acupressure works. Acupressure, Chinese medicine, it's all about balance in the body. So if there's pain or disease, there's some kind of imbalance. So acupressure has been an important technique used in traditional Chinese medicine for more than 2,000 years. Acupressure can be used to send a signal to the body to tap into the body's self-healing or regulatory mechanisms. In health, qi, as we call it, circulates through the pathways in the body that are called the acupuncture channels. If anything is blocked in that flow of qi, there's some kind of imbalance. So when there is blockage or it's not flowing properly, that's when we would say there's pathology or something's wrong with the person, some kind of imbalance. So in labor, what can acupressure treat in labor? I am really a birth geek. I love birth. It's like there's no place I'd rather be, and I really enjoy helping women go through the process. So one of the things we can help with is pain. I mean, it's an intense thing to give birth, so it definitely can decrease the intensity of the pain. It also helps with that nausea, the nausea vomiting that sometimes can happen in labor. And oftentimes when somebody is in labor, they need a little bump just to help keep them going or to push them along a little bit. So we call that natural promotion of labor. So I don't say acupuncture, acupressure is an induction. It naturally helps promote the labor. And again, it helps with decreasing stress and anxiety. So how we diagnose in Chinese medicine is we look at the tongue. The tongue is the only muscle you can see outside of the body. So it gives us a good understanding of your internal health. We also feel the pulse with 3 fingers, and it relates to 12 main organs in the body. We're also observing, we're looking, are they pale? Do they have dark circles under their eyes? All those things. We can touch them, and then, of course, by whatever their chief complaint is, and then whatever history we have presenting behind that. Okay, so preparation for labor. So this is one of the things that I see really often clinically, and this is where I feel like I can really share a lot of great information. So on my website, which is pushsandiego.com, there's a section called resources. And under resources, I've created several forms to help with pregnancy, with birth, and with postpartum. They're free downloadable handouts. So the one for preparation of labor is really, really important to know. And this is something you could start around week 34. So this is great whether you are the pregnant person, you're married to the pregnant person, you are the doula or birth support person. So we're going to go through these points, and I'm sorry again that my PowerPoint isn't being seen, but if you go to pushsandiego.com under resources, we're going to be looking at preparation for labor handout, if that helps you. Okay, so the number one point, if you know one point in all of acupressure, this would be the point to know. So it's called spleen 6. You can also Google it for the location, spleen in the organ and the number 6. So this point has so many wonderful benefits, including calming the mind, stimulating the birth, all sorts of things. It's really easy to find. If you touch your inner ankle with your pointer finger, with this finger, where the 4th finger hits, where your pinky finger hits, just out off of the bone in that meaty area, that's going to be the point. And the point's going to be really tender. That woman's going to really feel that.
So we're touching the right ankle with the right hand, the inside?
So if you are touching your right ankle with your right hand,
Okay.
then where your pointer finger is on the ankle, actually on the ankle bone, and then where your pinky finger is, and you're going to kind of slide that back towards your body so it's on the meaty section. Now find the tender spot. That's going to be the most important thing. Now with most women, this point is going to be extremely tender, whether you're pregnant or not. This is an incredible point for almost all women's health issues. So if you are full-term pregnancy, it's going to be extraordinarily tender, and you're just going to massage it. You can stimulate the points by pressing with your finger. You can do firmly, you could do a finger rotation movement, you could do an up and down, you could just do press, press. And I would recommend doing several minutes at a time. And you can do both sides of the body. Both the right and left side are going to be beneficial. And whichever one is more tender is going to be even, the best. So you can go right, you can go left, but spleen 6, this is just the best point for all labor-related issues. This is a point that is contraindicated in pregnancy. So if you're early pregnancy, you're not going to want to touch this point. But if you're at that point where you're at the end of your labor or at the end of the pregnancy and it's safe to do, you could do this as much as you want, pretty much from 34 weeks on. So now the second most important point that I would recommend is on your hand. This point is called large intestine 4, the number 4. And it is such a great point. Oftentimes people know of this point because it's the headache point. And a lot of people seem to know that point as the headache point. It is the master pain point in your body. So it's nice if you have pain anywhere in your body, you can press this point. So the way that you locate it is if you're holding out your right hand, and then with your left hand, you could touch the V in the bone between your thumb and your pointer finger. And then that bone on that pointer finger is just going to go about 1 inch, and it's going to be halfway on that little bone in that meaty part. Again, these handouts can be found at pushsandiego.com under resources, or you could easily Google for location. Again, you're going to be pressing, squeezing anywhere from 30 seconds to 2 minutes, and it really feels good. This is such a great point when a woman is in labor and her contractions are coming. You can squeeze this every single contraction she has, and she'll feel such a difference if you're supporting her and you're showing her, even if you show these 2 points and that's it. Every single time she has a contraction, she's going to raise a hand, raise a leg, because she knows it helps her feel better, as well as it's going to be promoting the labor. So one thing to mention about this point that I thought is so great is if a woman's in a hospital and she's connected to the tachometer or the machine where they measure the contractions, and say those contractions are getting erratic and it's kind of going up and down all over the place, by pressing on large intestine 4, this point on your hand, that is going to help to smooth the flow of the contractions. Just pressing one time, it's going to help. It's a squeezing of the point, but it's really incredible how quickly that will bounce back into the regular flow. So another thing to know about is ear acupressure. So acupressure, or the ear, is a microsystem of the entire body. A lot of people know about reflexology for the feet or iridology for the eyes, but there's something for the ears as well. So there's over 400 points on the body. And ear seeds are non-invasive, it's safe, it's an effective tool to stimulate points on the system. So the seeds that I use are called vicarious seeds, and it's a small seed from a flowering plant. It kind of looks like a poppy seed on a Band-Aid, and it easily attaches to the ear. There's a company called earseeds.com. It's a great little company. They have all these different kits that they created for different things. So related to the pregnancy is a postpartum kit. So I worked with a company and helped them to come up with a kit that is for labor as well as postpartum. So it's called a postpartum kit. And they even have classes on their website on how to use each kit, the benefits of the kit. This kit is great because it helps with everything with labor promotion as well as postpartum everything. So it's a fun little thing to know of and just a great little tool to have. So once you've reached full term, and I guess in different countries, different states, it's going to be a little different. So in California, in the United States, it's about 37, 38 weeks where they consider full term. So I say 38 weeks is fully safe, and that's when it's the true go time. So you can get a little more aggressive with your acupressure techniques. And this is a great time to do acupressure daily. You can do this on yourself or with the help of your partner. And again, these resources are on the Push San Diego site. And this one that we're going to look at next is called Natural Promotion of Labor. So natural promotion of labor, we're oftentimes working on the woman's glutes or butt, her backside. So these points are incredibly powerful for labor and to really get things going, as well as pain reduction. So there's a point called gallbladder 30, just the number 30, gallbladder 30. You could Google that point, or again, look at the downloads. And if anybody has ever given birth with a woman, had supported her, they may have learned a tool called the double hip squeeze, where you're basically squeezing together the meaty part of her glute. Typically, she'll be on her hands and knees, maybe leaning over a birth ball, but that squeezing of the glute there and that meaty part is that gallbladder 30. So it's something where the partner, especially if it's a man and he's a good size, it's great because he can use his strength and his size to really help with reducing the intensity of her contractions. So you would squeeze both sides at the same time with strong pressure, and you're pushing together for 30 to 60 seconds. You can find different angles that work best for mom's comfort, and just make sure you would check in with her to see, feedback. How's that? Do you want me to move up, to move down, whatever? And we can go back and forth between this point and the next points that I'm going to share with you. So the next points are called urinary bladder 31, 32, 33, 34. Anybody that's familiar with anatomy, this is the sacral foramen points. So in our sacrum is the triangle butt bone on the back side of our bodies. There is 4 holes on each side, 8 in total. So these are incredibly powerful for promoting the labor. So oftentimes when I'm with a mom and maybe she's about 7-8 centimeters along and she's kind of like done. Oh, I don't want to do this anymore. It's too much. So I will have her on her hands and knees and press in with my fingers, just with my thumbs, really strong downward pressure towards her feet. Oftentimes this will help promote the labor so that it can happen a little bit quicker at this point. I just can't say enough about these points on her backside. Sometimes it's hard to find. So really it's just a matter of getting the right angle. Maybe you try, instead of your thumbs, you might bend your pointer finger and use your knuckle, or you might use different fingers for different holes. It'll feel differently, and she'll tell you immediately if it feels good or not. So it's just great to know. So again, the natural promotion of labor points, you could use the spleen 6, the ankle point. You could use the large intestine 4 point, and you can use those sacral foramen points, the holes on your butt. So you can use them as often as you want. Really, every couple of minutes you could be pressing, every contraction you could be pressing. It's really, really helpful for the moms, and they tend to really feel like they have control of things when they have a partner that is pressing these points with each contraction. This is really great, especially for moms wanting to do a natural birth, because it gives them another option for labor and birth. The spleen 6 point that I said, the first point, is so incredibly good for promoting labor, and it's also really great for postpartum. And if you feel along that area and it's tender, that means it's indicated for that woman. So if it is tender, you could be pressing that postpartum, and that will help with her postpartum recovery in addition to all this labor stuff. Okay. So another thing that I see very commonly in labor is if the baby's in a wrong position. So they call that sunny side up or occiput posterior, and that it just means the baby's not in the optimal position. The ideal position is called occiput anterior, where that means the baby's facing the backside of mom as they're coming out of the body. And not every baby comes out that way, so they could be tilted a little bit to the left, a little bit to the right, or if it's completely opposite, it's kind of like spine to spine, the mom and baby, and that makes it a little more challenging. So one of the techniques that I find incredibly helpful is that if you can get the baby into the right position, then the baby will turn very quickly. So If a midwife or a doctor says, okay, the baby's ROP, like right occiput posterior, we're going to put the mom on the right side and do this technique. So the points that we're going to use, this is on the handout. So again, I'm sorry you can't see my slides, but it is on the handout for acupressure for labor. And this is a section malposition baby. So there's 3 points. So spleen 6 is again one of these. So this, I would often come in and I would share with the partner, the midwife, the doula, whoever's in the room, these points, and then we do a massage technique with it. So the points are urinary bladder 60, which is on the outer side of the ankle. So if you touch your outer ankle and then you kind of go down into that dip, that is going to be the point there, is that outer dip. And then urinary bladder 67 is going to be 1 millimeter below to the outside of the body of your pinky nail toe. So of the toe on the nail, and it's just 1 millimeter lateral to the side there. So these 3 points, I might be tapping urinary bladder 67. I would definitely put those ear seeds that I mentioned on these points. It makes it easier for the family and for the doula to find them and locate them. And then I would typically do a massage technique. So there is a technique called hip rocking. So this can be done many different ways. And I do have a video on YouTube. I don't know if there's a way that I could share my PowerPoint that you could show with your audience to share this. If anybody wants to see it, I'm happy to send it to you. So it is on YouTube, but I'll just explain it briefly. Hip rocking is when the woman's on her side. She will typically have a pillow between her legs, a pillow beneath her head, and then the doula or myself, whoever's there, is just going to rock her hip. So say you're touching her hip and you're just pressing forward and back. Now you're going to see the mom kind of undulate and moving, rocking back and forth, and you see her moving from her toes all the way to her nose. And in this rocking, you have the doula or the partners pressing on those points, and I'm doing the rocking, and typically that baby will relocate and move fairly quickly into the optimal position. So for example, I'm doing my doctorate, and part of my program is to do an internship. So I chose to work at a birth center, and I worked half my hours clinically, and then I put myself on call so I could share with the midwives how I might be able to help in birth. So I get a call one morning, it's 5 a.m., and they tell me there's a woman, it's a first-time mom, she's 8 centimeters, her baby's OP, meaning sunny side up or in the wrong position, and could I come help? She really didn't want to transfer to the hospital. What could I do? So I went to the birth center and I did exactly these 3 points, spleen 6, urinary bladder 60 and 67. She had a room full of helpful people, so it was wonderful to get her partner, the doula, her mother, all involved. Everybody had a point, and I did the hip rocking, and it was beautiful. Within 15 minutes, the baby turned, she got in the tub, ready to give birth, and then I went home. My job was done. So it was great. So there's another point called pericardium 6. If a woman gets nauseous, this is very common in labor that someone will get nauseous. This is great even for seasickness. If you're out in a boat or on a plane and you're nauseous, it's a really great anti-nausea point. The way that you would locate it is if you put one hand, so you put your left hand out, and then with your right hand, if you put your ring finger right at the crease of your wrist, and you're in the middle of 2 tendons, where that pointer finger hits, that is the point. Again, you can Google this, pericardium 6, or also check it out on the Push San Diego. On the resources, you would stimulate, again, press firmly with your finger. You could do the up and down movement or round and round, and several minutes at a time. Often a woman will just feel better while you're doing that, or she might vomit and then she's going to feel better. So either way, it typically works. Another point that's really great to know is called kidney 1. And so this point is at the bottom of her foot. It's located at the sole of the foot, and it's approximately 1/3 down from the base of the toes to the heel of the foot. It's in the center of the foot where the arch starts. So this is a great calming point and grounding. It's at the bottom of the body. So oftentimes if a mom's nervous or in fear, anxious, anxiety, something's going on in her head, if she's in a hospital bed especially, you can come to the base of her bed and hold her feet, and you just apply strong pressure. You don't even really have to press, rub, or anything. Just holding that point will help anchor her chi and pull the energy down and help her not be as anxious, be less scared, and it's incredibly calming. One of the last points I want to share is a point called stomach 36. This is, again, you can Google it, you can look on the resource. This is an incredible point. So in Chinese, the point translates to like 3 more miles. And my understanding from school when I learned about this was that the soldiers in China, when they were marching through the freezing cold and through the towns and such, they would stop and they would massage this point, and then it would help them travel 3 more miles. So oftentimes in pregnancy and in birth, it can be a long time. So as a woman's pushing, or she's kind of going through her labor, she's going to get exhausted. So this is a great point to know about. You can just press, rub. Sometimes it's tender, sometimes it's not, but I will often use this point in between her pushing so that it can help with keeping her energy up as the baby is descending and coming out. Okay, so when it is the pushing stage, there is some points that we can utilize as well to help with the pushing. So one of the points is called do 20. So that is the very top of the head. So if you drew a line from the top of your ears all the way to the top of your head, that's going to be the point. So now this point is the highest point on the body, and we're able to, let's see, the highest point of the body. So what goes up must come down. So oftentimes when I'm with a laboring mom, she's giving birth, she's pushing, I'm going to be touching the do 20 point, in addition to the point that's called gallbladder 21. It's pretty much where our bra strap hits, ladies, and it's the top of the shoulder blade. So by squeezing that point or using strong downward pressure, oftentimes I'll tell the partner, so they'll be pressing on one side, I'm on the other while she's pushing, and then in between we might just massage her. So it's just a great little adjunct to whatever else you're doing, but it definitely helps the pushing process. Another great story I have was I was with a woman as a doula in a hospital, and oftentimes it is challenging to give birth in the hospitals naturally because the hospitals are businesses and that's how they make money is with intervention. So sometimes you're working against the system to be able to birth naturally in some hospitals. So this woman was able to have an unmedicated, no intervention birth in a hospital. And then as soon as the baby came out, the placenta wasn't coming out immediately. And so in normal physiology, it can take 1 to 2 hours for that placenta to come out. But in a lot of hospitals, the doctor cannot leave until the birth is wrapped up. So they really want that placenta out. So this woman gives birth all natural. And then the doctor says, add the Pitocin to get the placenta out. And the woman was just desperate. Please, please don't. I don't want to have Pitocin. I just birth naturally. What can you do, Deb? Can you help me? And so I asked the doctor, can I have a minute? I actually got on top of this woman on her bed, had her lift her breasts up. This is a very tender point under, it's called liver 14. It's in line with the nipple. It's in the 6 intercostal space, and it's usually where the wire, the underwire for a woman's bra would hit. So I pressed down really hard on this point, and within 1 minute, her placenta came out. So no interventions needed in terms of Pitocin or anything else. And she was so happy to not have that kind of intervention. So it was just nice to be able to provide her with an option. So that is my summary in terms of acupressure for labor, acupressure in general. So do you guys have any questions? Can I answer any questions or help solve any mysteries or anything anybody has? I'd love to support the best I can. Thank you guys for your time.
Thank you, Deb. I do have a question just of curiosity, which is you mentioned that the tongue is the only muscle that we can see and use it for diagnosis. Anything to expand on that without, I'm not asking you to do a tongue diagnosis class here. It's just an interesting thought.
Yeah, it is interesting. We look at everything from the color, the coding. We look at the geography. Certain areas relate to different organs. Is it moving? Is it wet? And then so like the color, the coding could be thick or thin. It could be in different areas of the tongue, could relate to pathology in different areas. So it's quite an amazing tool, and our tongues will change over time. So I know some people say they brush their tongue or that you shouldn't brush your tongue, but if you are going to an acupuncturist, I would not recommend brushing your tongue so that you get a clear example of what your tongue really looks like. And if you notice your tongue looks weird, if there's a black spot or something, that could be a problem in a different organ of your body as well. So it's really interesting to do tongue diagnosis and see tongues change. And, you know, look at your tongue, look at your partner's tongue, your kid's tongue. It's interesting to see how different our tongues really are.
That's right. More questions?
Is there any questions? Is there a way that I could share with you my PowerPoint? I'm happy to share that to the audience.
Sure. If you can send that to me, I will send it out to everybody.
Okay, beautiful.
That'd be fine.
Does anybody have questions?
No, we're sorry that you weren't visible to us.
No, I did a PowerPoint and everything for you.
Yeah,
So,
yeah. Well, you're an excellent speaker. I really appreciated it.
Oh, thank you. Well, it looks like somebody asked a question. Can kidney 1 slow down the labor towards the end? In other words, contraindicate it as it might slow it down. Kidney 1 is more of a calming the person down. I wouldn't say it's slowing the labor down, but it's more calming and bringing the energy down. I use it often when the woman is anxious or she's in fear. She's kind of got a lot of things going on in her head. So that's very calming, the kidney 1. Any other questions? We're good? Awesome. Well, thank you so much for having me.
Thank you.
I am grateful. I hope you all have a wonderful day.
Thank you.